So the neonatal seizure classification came out a few years ago, and I shared it at the epilepsy meeting because it's still clinically relevant. So this classification takes a baby who does anything suspicious of having seizures, and we do an EEG right off the bat. So anything non-epileptic, we don't classify, and we only classify the babies that have epileptic seizures. So we break those down into clinical only seizures and electrographic only, and those are the babies without clinical signs. So with clinical signs, we break it up into motor and non-motor. And the motor semiologies are automatisms, clonic seizures, epileptic spasms, myoclonic, sequential, and tonic. And the non-motor classifications are autonomic and behavioral arrest, as well as sequential can be included there as well. And sequential is when there's not one predominant seizure type. There's a bunch in a cluster. And this is important because it can help us diagnose the syndromes, which also has come out recently, the neonatal epileptic syndromes, and it really helps us think about etiology. So it helps us really with diagnosis and with treatment. First, identifying the semiology will help us decide whether it is infectious or HIE or due to a specific gene. It's really important looking at a whole bunch of things because time to diagnosis is really important. The sooner you correct the acute insult, the better it is, since the majority of neonatal seizures are due to an acutely provoking insult. And so looking at the baby, getting a history, sending basic labs from the beginning, looking for low glucose or an infection or something like that is very important. And using the semiology that I just described also helps point in the right direction. So it's very hard to diagnose clinically. And most of the time you really need an EEG to see exactly what's going on, especially with those syndromes that don't have any clinical manifestation like behavioral arrest or automatism or the autonomic seizures. Those are very difficult to diagnose without an EEG. There was a paper that came out by Pellegrin several years ago looking at diagnostic certainty. So they found that the easiest to diagnose clinically are tonic seizures, where it's focal stiffening, and clonic seizures, which is a rhythmic jerking. Those are the easiest to diagnose at the bedside. Otherwise, it's really hard because these are really sick babies that do really funny movements, and they're just under a lot of medications and have a lot of procedures going on. So it's very difficult to diagnose clinically without an EEG.